People with Graves' disease need to eat healthy and take the proper nutritional supplements if they want any chance to restore their health back to normal. Most people with this autoimmune thyroid disorder don't modify their diet at all, as they simply manage their symptoms with anti-thyroid drugs or radioactive iodine. But a proper Graves' disease diet can really make a big difference in one's recovery. The reason why many people don't consider a Graves' disease diet is because they assume that their condition is incurable. But in many cases, it is possible to restore the function of the thyroid gland in a person with Graves' disease. When I first was diagnosed with Graves' disease, I honestly wasn't thinking about changing my diet right away, but I soon came to realize that many people with this condition have nutritional deficiencies that need to be addressed. And so what I plan on doing here is to share some of the common nutritional deficiencies people with the disorder have and what foods and supplements one can take to improve their health. When discussing any Graves' disease diet, one needs to focus on certain nutritional deficiencies. The following are just a few of the common nutrients and minerals people with this condition can be deficient in. Many people with Graves' disease are surprised to see iodine on this list. Some healthcare professionals assume that people with a hyperthyroid disorder have an excess of iodine, and as a result will recommend that people with any type of hyperthyroidism avoid iodine completely. This might seem to make sense when you consider that this condition involves an overproduction of thyroid hormone, and iodine is necessary to produce thyroid hormone. But excess iodine is usually not the cause of a hyperthyroid condition, as there are other causes of the malfunctioning thyroid gland. But the proof of this deficiency lies within the testing. Dr. David Brownstein, who is the author of the book Iodine, Why You Need It, Why You Can't Live Without It, has tested thousands of patients for iodine deficiencies and found that even in people with Graves' disease, iodine deficiency is very common. If you're still skeptical, the best way to determine whether you are deficient in iodine is to take an iodine loading test, which you can find out more about by visiting hakalalabs.com. People with Graves' disease need to make sure that they aren't deficient in B vitamins, and selenium is another mineral people are deficient in, which is extremely important in thyroid health. The good news is that you can get all the selenium you need by eating a handful of raw Brazil nuts each day. Magnesium is also a mineral that many people are deficient in, and you could get the magnesium you need by eating green leafy vegetables, nuts, kelp, as well as other foods. Many people with Graves' disease also are deficient in vitamin D. In fact, vitamin D has been shown to play a vital role in immunity, and studies show it can help prevent or stop an autoimmune response, which of course is important with someone who has an autoimmune thyroid disorder. Once again, to determine whether or not you are deficient in vitamin D, you can get a vitamin D test. For more information on the benefits of vitamin D, visit www.vitamindcouncil.org. There are other trace minerals as well that people with Graves' disease are deficient in, such as zinc and copper. As part of any Graves' disease diet, you want to minimize any refined foods. There are a few reasons for this, but one of the biggest reasons is because refined foods are depleted of nutrients. In the refining process, they remove the nutrients and then attempt to replace some of these through the process of enriching. But the truth is that enriched foods do not have most of the original nutrients that were removed in the first place, which is why you want to try to eat as many whole foods as you can. Some examples are vegetables and fruits, nuts and seeds, chicken and turkey. You also want to eat plenty of healthy proteins. Assuming you're not vegetarian, you can eat lean meats such as chicken, turkey, and fish. You ideally want to buy organic meat so that you're not ingesting any of the synthetic hormones that are commonly given to livestock. I personally have a healthy smoothie to start my day, as I have a cup of frozen berries such as raspberries, blueberries, and blackberries, 2 cups of purified water, some quality protein powder, flaxseed oil, and 1 raw organic egg. You just want to make sure that you consume healthy proteins, and you want to try eating at least a small amount of protein during each meal. As for what supplements you should take as part of your Graves' disease diet, I want to begin by reinforcing that nutritional supplementation can be an important part of the recovery process. With that being said, there is no miracle supplement that can cure your condition. Another important point is that even though nutritional supplements and herbal remedies are natural, this doesn't mean that there aren't risks when taking them. This is especially true if you're thinking about self-treating your condition, which is why it's always a good idea to consult with a competent natural endocrine doctor to minimize these risks. The following are some of the supplements and herbal remedies I took when I was diagnosed with Graves' disease. Some of these I still take on a daily basis. I already spoke about iodine briefly, as many people are deficient in this mineral. I also spoke about vitamin D and gave a website you could visit to find out more information on this important vitamin. You definitely want to make sure you get plenty of the B vitamins. Selenium is yet another important mineral we need. Bugleweed is an herb, and I took a liquid form that really helped reduce my symptoms, specifically the high pulse rate and palpitations. You probably have heard of echinacea, as this is a great herb to help with immunity. Eleuthero is an herb that is involved in adrenal support and is very helpful for anyone that deals with chronic stress on a regular basis. This doesn't mean that everyone with Graves' disease should be taking the same supplements and herbs, as different people will need different supplements and dosages, depending on their symptoms, lab results, and other factors. This is why I think it's foolish for someone to attempt to self-treat their condition, as if you want optimal results, then it's best to consult with an expert. In summary, following a strict Graves' disease diet can really do wonders with regards to restoring one's health back to normal. Just keep in mind that while eating properly and taking supplements can be beneficial, there are other factors that are equally important in the recovery process, but modifying one's diet is a great place to start. To receive more natural thyroid health tips on Graves' disease, please visit naturalendocrinesolutions.com, where you can get a free guide entitled The 6 Steps on How to Treat Graves' Disease and Hashimoto's Thyroiditis Through Natural Methods. This guide contains 100% pure content and is not a sales pitch for any product or service. Thanks for watching this presentation.